to us. It was the most enlightening experience we all had.
I know, I agree.
That's encouraging. Thank you.
The way you spoke to us last time, it was so motivational. It's like we needed it.
Thank you. Hopefully this will do the job and get more of you to apply and come. I mean, I wish I was being sponsored, but I'm not, by the club people. But I want as many, it's good to have options.
Yeah.
Thank you for doing this.
Yeah, no, thank you for having me.
Okay. So Samantha, how is it on your side? Are we starting to accept people? When do you want us to start?
I think we can start, but before you start, I think we can give everyone a chance within the 86 participants to also share within the circle so that as we start, we're all starting together. So we can start in a minute or two. Yeah.
Yeah, make it 8:05. Make it 8:05 also.
We'll start at 8:05. So guys, feel free to share the link with your friends. Yeah, we don't want to leave anyone behind. Yeah, but we'll record, all the recordings are actually available. We'll also see if we can download them and put them on a drive so that they're accessible throughout the year. Yeah. Oh, I see Winnie is in the house. Hi, Winnie. I think Winnie can say something as you're waiting.
Yes. Hi, Winnie.
Hi, Samantha. Hi, Chris. How are you guys doing?
I'm good. It doesn't feel like a Saturday, but I'm good.
But thank you so much for bringing this to us. And I'm looking forward to a good session. Yes. And Karibu Sana, I think I've seen Dr. Ritika. I don't know whether she's in the house.
Hi, yes.
Hi, thank you so much for setting aside time for us. We look forward to learn from you. Thank you.
Thank you for having me today. It's a pleasure.
I don't know who else is in the house would love to say something in that 1 minute. I'm using my phone.
Esther never misses. This is Esther there.
I can't see her. I'm actually past an E. Yeah. Hi, Philip. I'm seeing Norman is in. Hi, Norman. Hi, Cheryl. Cheryl is one of those dedicated people. She's really been doing a lot on this. Yeah. Silently behind the curtain, the effects have been felt. Thanks so much, Cheryl.
Thank you very much for the acknowledgement.
Yeah, Pratik is also in. I see Saina. I'm not so sure if it's the Saina. I know Tejal as well. Tejal is also part of the team that's leading this, and it's 8:05. So Chris, back to you. And Kamau, they'll be the moderators for today. And welcome, Dr. Ritika.
Thank you.
Okay. Is Kamau?
Yes, I'm here. Sorry.
Okay, so Kamau, you can start us off.
Okay, good evening, everyone. My name is Kamau Jonjo. Welcome to this Moving Abroad series organized by AMSUN and the committee in charge of it. This is the third of a series of 5. We thank you all for attending. I know the hour is late. This evening we have Dr. Ritika. I'm not going to pronounce the second name. I let her do it so I don't mispronounce it. She's here to talk to us about moving to the UK, the process, and how she went through the process and her experiences then and currently. So I think I'll leave it to Arisi to introduce her, and then I hope all of you will enjoy this session.
Okay, Sasa, thank you, Kamau. So yeah, it's Dr. Ritika Ganda, alumni of UN, and she wants to share a bit about her journey. So I don't want to take too much time. So Dr. Ritika, take us off.
Thank you both. So thanks for having me today. Hopefully you'll find this useful and a little bit motivating as well. Give you a bit more of an idea of what it is like in terms of application process and living here as well. yeah, I did a similar talk in September last year, and I got a lot of questions, and it would be interesting to find out how many people went through with it and have started the process. But yeah, I'll get started. So I have a brief presentation, just giving you a little bit of a summary. I was given a list of questions. I think I have answered some of the questions in here, but I will go through the questions afterwards, and then hopefully we'll have some time afterwards for you to ask anything else that you think of along the way. So essentially, I graduated in 2014 UN, and I did a part-time MSc in respiratory medicine, which I finally completed last year. It was really, really part-time because I was working full-time. And right now I work as a GP registrar, which is similar to family medicine in the United States. It's a little bit like internal medicine here. I'm an ST3, which is the last year now, and member of Royal College of GPs. Don't know if I'm struggling to go to my next slide. Okay, so essentially, every journey is different. This is what I went through. There's no guarantee that it will be the same for any two people. You just have to take it as it comes. It's just so that you get a little bit of an idea. So essentially, I went through just a little bit of background. I mentioned that I completed medicine in 2014. We had a gap between graduating and starting internship. I had a couple of months. I worked as a research assistant, and then started my internship at KNH. And then I had a locum job. I was already at this point thinking about applying for the PLAB, so I sort of geared my jobs around that, giving me enough time to study. So I worked as a full-time locum initially, and then moved on to a permanent job for a year and a bit, while I did my exams and sorted everything out. Then in March 2018, I finally made the big move. So in terms of the exams and my registration, my job applications, so when I was doing my internship, so you can see I finished internship in April 2016. December the same year, I did my Ielts exam, which is the English entrance exam that you need to pass. And then 6 months later, I did the PLAB 1 exam, and I came to the UK for that. And then I did the PLAB 2 exam October the same year. So really a bit of a marathon, but every 6 months I did one of them. And within a year, I had completed the PLAB exams and the IELTS. By January 2018, so you can see how fast I managed to do that. So October, November, December, by January, I completed my GMC registration. So GMC are the medical governing board in the UK. They call the General Medical Council. They look after all the doctors, they look after your registration. They've also sort of review and do appraisals and things like that once you have a job here. And then as soon as I had my GMC registration, I started job applications. Lucky enough to get interviews fairly quickly, and I had a job by the next month. I applied for my visa, and then I moved. I think some of the questions were about whether it's important to do internship before you move. Internship is not a prerequisite, but I would say highly important if you can. It gives you an employment history, which is very important. It's important for your visa applications. It's also important when you're applying for jobs. If you have not done internship, there is the option of going through the F1, F2 route, but this is extremely difficult. It's even difficult for people that have trained in the UK and Europe. So for international graduates, you can be waiting a long time to get into a job as an F1. The other thing is to meet visa requirements, you have to meet a certain threshold in terms of salary. F1, F2 is the equivalent of internship here, and you just don't earn enough to meet the visa requirement. So it's just too complicated to go that way, I think. And I would recommend do your internship. And it's not just about getting that employment history. Internship just gives you some of the skills, the skill set that you need to be able to work in. I think my internship was really good experience. All the rotations that you go through and all the skills, hands-on skills that you get. When you come here, you definitely have a little bit of an upper hand because you've done all of that before and they see it. The other acceptable routes, so there were lots of questions about this as well. Someone asked, can we do MRCP and then become a consultant? Or can we do MRCS and become a consultant? So the answer is no. Your Royal College exams, they are a good qualification to have, but in terms of you applying for training, once you get your GMC registration, you apply for training, and during your training, you're expected to pass these exams. These exams are just a part of your training in terms of becoming a consultant in the UK. There's a lot more competencies that are required. So in terms of procedures, patient, communication skills, also things like, training students, training other doctors, there's, publishing papers, there's a lot more to becoming a consultant than just passing the exams. So it's not enough. You definitely need to pass the exams, but it's not enough to just do that to become a consultant. So every consultancy job, whether surgical, medical, pediatrics, you have to pass the exams to become a consultant, definitely, but you passing the exams isn't enough. The other thing is, someone asked, can you do the Royal College exams instead of the PLAB exams? Yes, you can. Doesn't, it's an alternative route. It's definitely more difficult, and you need to do more than one exam, I believe. So for example, the MRCS, or if you do the pediatric exam, MRC, PCH exams, you need to do the first 2 exams and then apply for your GMC license. And then you can apply for a job, which wouldn't necessarily be a training job initially. And then you can get into training. You'll definitely have the upper hand when applying for training. But I'd say it's no different. If someone's done PLAB and you've done the MRC PCH, with the MRC PCH, you might get a job at a slightly higher level than the one with the PLAB, but not much of a difference. Yeah, so I would say do internship. And then if you can get a job afterwards as an MO, SHO, whatever it is, and then do your application process, while you're doing that. So I'd say the right time to start applying is towards the end of your internship, when things are starting to settle and you're not as busy as well. And then, once you've done your GMC licensing, what next? So I would believe, or I'd like to believe, that anyone that comes here, ultimately your goal is to train and to specialize in something. So you've got a couple of options. There's run-through training, which are usually quite long, so it can be up to 8 years or up to 5 years. Now the other option is GP training, which is what I started, which is also quite tough. It's 3 years. You're supposed to do 18 months of hospital rotations and then 18 months in practice. I'll give you more information about that later on. You've got to do exams along the way. So you've got Royal College exams to pass. You've got lots of portfolio work. I'll talk about that later as well. Now, for you to apply for training, this is very important. There is a competency form that you can find online. I will share all the links. You need to get this signed by either one of the consultants you've worked with in your internship or one of your jobs. You need somebody to sign it and stamp it. It's a form that goes through, it's a little bit like your logbook during internship or your logbook during your rotations in when you're in year 4 or 5 of medical school. So it's got all of these competencies that need to be signed off in terms of procedures, in terms of your skills, and it's valid for 2 years, and it's always good to have it done back home if you can. It is difficult to get signed when you come here. Also because if you apply for a job, for example, in pediatrics, then there are some of the competencies about care of the elderly you can't get signed when you're in pediatrics. So it becomes really difficult. So that's one form to get sorted before you come here. Yeah, so you need a consultant signature in there, and it allows you to be eligible for your training application, which I think should be the ultimate goal, but it depends. So in terms of the Ielts exam, so this is the English language test, and you need your Ielts to apply for the PLAB 1 exam, and you need a fairly high score, so you need to get at least 7 in each of the 4 sections and an overall score of 7.5. It's valid for 2 years. So you need to plan yourself in such a way that a lot depends on your IELTS, because you need this score in order to in order to progress. The earlier you do it, the better. Try aim to do, I would say, the IELTS towards the end of your internship, so that you can quickly get this out of the way and then go ahead with the exams. So PLAB, these are the licensing exams for international graduates who wish to practice in the UK, and there are 2 parts. So we've got the PLAB 1 and the PLAB 2. So the PLAB 1, I was looking at this just yesterday actually, because I think they've made a few changes because of COVID. So the PLAB 1 is a knowledge test, so it's MCQ based. They can ask you about anything, from statistics to obstetrics, pharmacology, a bit of anatomy, everything and anything. And in my time, it was 200 questions, but now it's 180 questions. So you're, I think, better off in terms of timing, and it's for 3 hours. The GMC website has details about the dates and the booking details, which seem to keep changing because of COVID. But the PLAB 1, you don't necessarily have to come here to do it. I think, for example, Nigeria have a couple of centers because they've got so many students that come here from Nigeria. We've got South Africa that have got a center. So you might have to travel, you might have to travel, but it might be easier to get to some of those places than it is here. But it's up to you in the end. In terms of reading material for the PLAB, so this was one of the questions as well. So this is what I used, and I believe most of this is still in place even now. So you need to get, you need to do question banks. So there is a set of 1,700 questions that one of the doctors had published around my time that were really quite good. I even thought, I think quite a lot of the questions were repeated from there, similar questions. I went through all of those with a friend and I did them again on my own. And then the GMC website has a PLAB blueprint document. That's got the curriculum that you need to know. The pass rate is about 60 to 62%. It's not bad. I think it's a walk in the park for someone that's done all those exams at UN. Yeah, so you just need to work at, you just need to complete the questions, do as many questions as possible, go through the curriculum. The only difference is the guidelines in terms of how we practice medicine in Kenya and how we practice medicine here. There are some differences in terms of the medications available, the diagnosis, the way you think about your diagnosis as well. But it all comes with practicing questions. In the PLAB 2 exam, you definitely need a visa because you have to travel. It's an OSCE exam, so I believe everyone's been through OSCE. So you have 18 stations, lasts about 3 hours, 20 minutes. You have 10 minutes per station and you're given a patient and they could have anything. These are usually actors. And then you go station to station when the bell rings and you basically have to have a consultation. You have to manage them in a structured way. They look at your communication, empathy, things like that. And for this, it's good to have study partners. I did enroll for a training course for this exam because I think the style of consulting in the UK is slightly different as well. You do get used to it when you start working. It's still the same history taking, it's still the same structure. It's just the way they expect you to communicate. There are some things about, for example, safeguarding problems, things that you might not be very familiar with in Kenya, but you might need to learn about when you move. So what happens next? So if you've passed the PLAB 1 and the PLAB 2, then you apply for your GMC registration. It took me about a month to do this. It really shouldn't take that long. It's an online application. They allocate you an officer who goes through your application and helps you with it. they really asked me, I think this was the bit where I felt it got a little bit tough, but not impossible. They asked me for a lot of documents. And I was running back and forth, to my internship center to get a letter from the dean to say that I've done this rotations. And then for my jobs, they just want a lot of evidence. They also don't like it when you have gaps between your jobs, because then you have to explain your gaps, to explain what was happening. Why were you not working in that time? So, for example, I had my research assistant job February to April or March, the year that I started before my internship. I was asked a lot of questions about what I was doing in January. So they nitpick every little bit of your history. So if you've got gaps, don't worry about it. You can always say you were waiting. I just said I was waiting for my internship to start. There was a delay. You just have to write lots of letters explaining these things. They do understand. But just if you can avoid it, try to avoid it. If you can't, then you just have to explain yourself. And then job applications. So this is really fair process. There's an NHS jobs website. It's a standard website for all jobs in the NHS. You upload your curriculum, your CV, and you fill out the form. It's quite detailed. There's a lot of pages to it, but you just have to do it once. And then you look through jobs that you like, and then you just keep submitting. So you submit as many as you like to different locations. You can search by location, you can search by job level, and then they get in touch with you slowly regarding interviews. So all you need to work in the UK is your GMC registration, and hopefully by this point you've had it all sorted. Now, in terms of the GMC registration, I don't know why, but sometimes they don't seem to trust universities outside of the UK to be at the same level. So they want verification. So they use this team, ECFMG, which was used in my time as well, where you have to get your university verified. So it's a website, you fill out a form, and then they send you a certificate verifying your university, saying it's real, which doesn't make sense. But I guess if you're having applications from hundreds of countries, then you might need something like this. So you need to get this done before your GMC registration. They do tell you about it, and it doesn't take long. I think it took me about 2 weeks to get the certification, but you have all of these things going on at once. So it does eventually all come together. Now, in terms of, so I did have to pay a certain amount to get this verification done. I believe it was about 6,000 shillings at my time. So I had to open an online account, upload my MBCHP certificate. And I would say as soon as your PLAB exam is completed, just start this process because you will need it for your GMC registration anyway. So in terms of getting into training, if that is your goal, your first job will probably be a non-training job, which is a good thing, because in a non-training job, you don't have that much pressure. You're able to find your feet. You can ask all the questions you want. You can still do that in a training job, but you need to get used to how things work here, how the computer systems work, how the teams work. It's different hospital to hospital as well. I would say when you're doing your non-training job, ask about getting an e-portfolio account. So every Royal College has an e-portfolio service, for example, pediatrics or GP. And when you have an e-portfolio, you can upload any courses you attend. If you have a consultation with a patient and you get a consultant to watch you and assess you, you can send them a form to fill out to say how you've done or to give you feedback. Lots of different, any procedures you do, you will log them on your e-portfolio. So it's essentially like a logbook, really extensive logbook. So you can put everything on there. Even interesting experiences you've had, you'll put them on there. It's quite good because when you're applying for training, you've already got all of these procedures done, or you've got, it gives you a bit of an upper hand. Any audits you do, any publications, any research you help with, you can put it on there as well. So it just helps to consolidate everything in terms of your training. And you can get access to it even when you're not training. So you can start, as soon as you start your first job, ask about ePortfolio access, and then you can start using it. So I would say this is just what I feel, but allow a minimum of 6 months in a non-training job, and then you can apply for the next round for your training job. So these are some examples of the non-training jobs available. So foundation year 2 is equivalent to, the second year of internship. That's the one I would not recommend applying for, but you can apply for any of these. So you can go for an SHO job, a CT1, CT2, ST1, ST2, clinical fellow. They've got junior clinical fellow, senior clinical fellow, and a junior doctor, trust grade doctor. Now, if you ask me the differences, to be honest, between the second one and the last one, the only thing that's different is the senior clinical fellow. So if you've done your Royal College exams and you've got experience, so for example, you've done a couple of years of training back home, then you might be able to apply for a senior clinical fellow. In terms of all the other ones, you're basically working together, you're at the same level, no difference in your salaries, so it really doesn't make a difference. Now, non-surgical fields, everyone thinks it's easier to get into non-surgical fields, but that's, it's not true. I think in the UK, radiology and dermatology are known to be the most competitive, but I have had colleagues that have got into training successfully. You just need to do a little bit of hard work. Surgical fields are also possible with the hard work and dedication. To apply for GP training, dermatology and radiology, I have to mention that you have more entrance exams. So you have to score a certain amount. You do have, someone asked about whether you have control in terms of your application and where you end up, and you do. So when I did my GP entry exams, again, 2 exams, I had an MCQ exam, and then you do a brief OSCE. It's not as hard as a PLAB 2, not as long as a PLAB 2, I mean. And if you've done the PLAB 2 exams and the PLAB 1 exam, it essentially prepares you for this entrance exam. There isn't much difference. You need, the higher you score, the better chances of you getting into the area that you like. So essentially you rank all the places that you want to work in terms of your preference, and then they rank you according to your score. And if someone has ranked the same place as you, but they've scored higher than you, then they might get that place. If someone drops out, from in between, you will get bumped up to the top spot in your list. So essentially, the higher you score, the better chances of you getting where you want. But you will always end up you will always get somewhere. So before starting a job, I would advise, speak to some of the colleagues. They always have Facebook groups, or you can see during your interview, when you hear back regarding your job, they will always give you contacts. You can ask the consultant to send you some of the guidelines for the trust, and you can ask about your banding. So banding is your salary and the rota as well. So there were a number of questions about USMLE, which unfortunately, I don't think I'm in a position to answer those. But PLAB versus USMLE, I would say that's a personal choice. It's a matter of timing. I think USMLEs are a lot more expensive as well. I don't know, I can't speak. I think you might have had talks from people that are working in these other places, but I think work-life balance is really good in the UK. Now, cost implications, there were a lot of questions about this as well. I think what you earn in your internship, if you save that up, it's more than enough to cover all of this plus more. So, you've got enough to come here and settle. And I was able to do all of that, with what I had in my internship and a little bit of what I earned afterwards as an SHO. So PLAB 1 costs £240 and PLAB 2 costs £879. You have to consider your flights, your accommodation, courses, if you want, the visa fee, your EC, FMG and GMC fee, which aren't that much, and your training fee. A lot of questions about how much you pay for training, and someone asked, how much do you pay for internal medicine? You don't pay anything. I think that's one of the things that drew me here is even when you're training, you're providing a service and you're paid for that service. And it's fair, it's completely fair. It depends on the number of hours you work. If you do night shifts, you will get paid extra according to the nights you do. If you work weekends, you get paid extra according to the weekends you do. So it's individual, but it's very fair. And the only fee I pay is I have a Royal College fee to pay and I have a GMC fee to pay every year. And it's not more than £300 a year, I think, total. So my advice is start saving, but you make it all back, so don't worry. Yeah, I think I spoke about some of this already. So you don't have any fee to pay. This also includes the training entrance exams. So those were free. You just have to do an application online, book your MCQ exam, the written exam, and then book your OSCE exam. And then you rank your jobs according to area and you don't have to pay a cent. Essentially, they use taxpayers' money to train you because you're doing them a service, I think, which is quite good. So this is a little bit of a random slide that I added in. It was just to give you a bit of an idea of, so I'm a GP trainee and what is a day, what do I do at the moment? So I'm training. So training involves, you've got teachings, you've got tutorials, you've also got to teach, and you've got patients to see, you've got home visits to do. So essentially, this is exactly my day yesterday. I started at 8:30. So as you continue training, they keep adding in more patients. So I start most days from 8:30, I end at 6. I do get 2 afternoons a week off. That's during the week. One is for training, so one is for me to attend mandatory courses. And the second one is a day off just for me to catch up on portfolio work, anything I like. And then, so essentially I work Mondays, Thursdays and Fridays full days, and Tuesday and Wednesday I'm half day, but Tuesday you've got mandatory teaching, and I'm off on the weekends, except for occasional Saturdays I have to work emergency shifts. So these are called out of hour shifts, which are also necessary for your training. So yesterday, started at 8:30. I get 10 minutes consultation time for each patient. Occasionally you'll get, so in between patients, here and there, you'll get 5 minutes extra so that you can catch up on your documentation, any admin, any referrals you might need to make, or look up bloods and things like that. So it's not really 10 minutes back to back. You do get some time in between. So I don't know if you'd be interested in this, but my first patient was a 30-week pregnant lady with a newly diagnosed pulmonary embolism last week. She came in, coughing up greenish yellow sputum. I then had a 1-year-old with difficulty in breathing. I had to send in for emergency care. I had to call in the paramedics. I had a 14-year-old suicidal patient sent from school, so sent to the GPs from school. I had a patient with heart failure, saturations of 69%. And then I had a patient with a high TSH. I had a patient with gout. And then I had a medication review for an elderly patient with multiple comorbidities. I saw a patient with psoriasis, young patient with testicular pain, then a patient with chronic cough, suspected TB. So there were a couple of questions about infectious disease and lifestyle. You can see this, and you can see it's so varied. You've got a mixture of your lifestyle. You've got a mixture of infectious disease. You just don't know what's what's going to come through the door. I had a shortness of breath, which is a long COVID syndrome patient. I had a 2-week-old with vomiting. So this was my morning session, which I completed by about midday. And then I had an hour you get admin time, meetings, if you've got practice meetings with the other staff. You get allocated home visits as well. So if there's a patient that's immobile in bed, elderly patients especially, they're not able to get out of bed, they're not able to come see you, then you can go see them as well. So you're given time for that. and you have to travel to them. They're usually not far away, they're usually in your area, and you do get a refund for your fuel money as well. And then lunchtime, so you don't really get a lunchtime, you generally eat as you work. This is in my job, but here and there I will get 10-minute break and I'll go out for a walk. You generally have ECGs come back from patients, you've got bloods that come through, the ones that you requested, letters that come through from hospital. I had a call for an urgent chest x-ray from the radiologist, for one of my patients that had a unilateral pleural effusion with a 3-week history of cough and weight loss. So, top differential of lung carcinoma there. My afternoon session also, you deal with such a variety of things. I had a 60-year-old who had a recent bereavement, essentially just wanted someone to listen to her. That was all. I had an 82-year-old with shortness of breath and leg swelling, 5-year-old with an asthmatic attack. I then had a home visit for a 97-year-old who was end of life, for end of life care and medications, patient with high cholesterol. So you get such a mix of, slightly more difficult cases and some that aren't that difficult at all, like the hypercholesterolemia review, just lifestyle advice. And then I had an inguinal hernia patient, had a patient who came back from Spain last week and now had severe abdominal pain. I had a 35-year-old with hypertension with blood pressure 180 over 120. And then I had a CT scan result to discuss with the patient, where he used to work putting down flooring in houses, and he now has features of asbestosis, shortness of breath. Then I had weight loss and abdominal pain in a 92-year-old, also suspected cancer, 60-year-old with bacterial vaginosis. And then I got an urgent blood results come through, for an elevated D dimer, suspected DVT. And then I had an elderly patient with urinary symptoms and back pain, so also think of prostate cancer. So you can see in a day's work, you get so much variety, you can't get bored. You're kept on your feet throughout, but it's always interesting. Every patient is so different. I think I really enjoy it, and I like the challenge of it as well. So I was home 6 p.m. I have exams coming up in a couple of months, so an hour's study session with a friend, and then catch up on portfolio work and tutorial preparation. What happens in my tutorials are some of the other fully qualified GPs will sit in on my consultations. So they will listen to you consult, and then they will criticize and give you feedback. So, I don't know if this is really relevant, but I think it's interesting, it's good for you to know about as an option. So why I chose GP training is it's a 3-year specialty, but you can extend it and do a specialty interest, fairly similar to internal medicine, but you have a mix. So you'll see pediatrics, obstetrics, surgical patients. You get a better work-life balance in terms of you have a lot more control on your job in terms of the timings when you work. It is your wish, whether you want to work weekends or not, once you're a qualified GP, and just progression opportunities. Again, I said 10-minute consultations. Every patient is so different. You have to think outside the box, and you get all of these patients. You get to follow them up till the end. So you will see their diagnosis. You will, work with them through their treatment, do their prescriptions. And then I also get to work GP out of hours. So these are the weekend shifts where you work emergency out of hours shifts. And then you can, after GP training, you can go into palliative care, you can go into geriatrics, research, you can run specialty clinics, so you can run family planning clinics or ENT clinics. One of the GPs I work with is a specialist in joint injections. One of the other ones I work with is a diabetes specialist. So he's a diabetes lead in my area. One of the other doctors I work with is a dermatology interest. So she runs dermatology clinics. She's a GP and runs dermatology clinics in hospital. And One of the other ones I work with is specialist in minor surgery, and they're all GPs. So they'll have a day like I did, but then they'll have days in the week when they will just do minor surgeries or dermatology clinics, whatever you wish, whatever you have interest in. So GPs see the bulk of the patients, you're the first port of call. The patient cannot go to a specialist by themselves, it has to be through you, and there's very strict criteria for what specialists see and what you manage. For example, heart failure is not managed by cardiologists, it's managed by GPs. Renal failure is managed by GPs, unless you have an EGFR of less than 15. So you can see how strict the threshold is in terms of referral. If you refer patients just because you don't know what to do, they will be rejected back to you. So you just have to sort of learn how to manage them with time and experience. So there were a couple of questions about whether an MSc is useful. When I applied for my MSc, I didn't really know what I was getting into, and I didn't really know what I would use it for. I did save up for it during my internship, and had a bit of a scholarship in the first year, but then after that paid for the next year myself. It was a 2-year part-time degree, but I did take a break in the middle when I was moving and settling in. So it took me a little longer to complete. I think it was good in terms of, it did give me an insight into research, reading and analyzing papers. I got to complete a dissertation, and you've got part-time options, so you can continue to work. There is no rush to do this, so you've also got this integrated into GP training. After I finish my 3rd year, I've been given again the opportunity to do an MSc if I wish, which would be sponsored this time. So it's just one opportunity after the other. It is good for your CV, and it will make you more confident when it comes to publishing papers. I did mine in respiratory medicine, which I think was really good. I did my dissertation in asthma in pediatric population and viral infections, which I think I've learned a lot from. And then the UK versus Kenyan system. So I'd say there were a lot of questions about this, and whether there's any benefit to working here. I'd say there's pros and cons for everywhere you go. Here, it's very evidence-based medicine. Every decision you make, there's strict guidelines to follow, and that's why it's not that difficult. For example, if you get a patient with heart failure, you have strict guidelines for what to do next in every possible scenario, so you know what to do. And the more you see patients, the easier it gets. When I started my job now, I started with 30-minute consultations. So I had 30 minutes with each patient, and then they slowly take that down. And I'm now on about 12 to 15 patients in a session, and they take that up to 18 maximum as you progress. So it's a really team-based approach. I felt there was less of a hierarchy here compared to Kenya, but every place is different. So the example in ward rounds in hospital, we would have the physiotherapist, we'd have the occupational therapist, the dietitian, we'd have a ward pharmacist, got your consultants, registrars, everybody together, and everybody's sort of input one after the other. The consultant have always asked me what I think. They always ask you your plan. It's a really good team-based approach, and you always feel involved. And I felt it's a less competitive pace here. It's more about working together. You feel really proud to be part of the NHS. It's a free healthcare service, and I think there's nothing like it in the world. Any patient can walk into hospital and get seen absolutely free, no questions asked, which is incredibly rare. You've got cancer patients having rounds of chemotherapy, surgery, and not having to worry about payment at all, which is incredible. So I think, these are just some of the examples. Why the UK? So in terms of the lifestyle, you've got access to Europe if you like traveling. Of course, that hasn't been possible in the last over a year now. It doesn't feel too far away from home. I had put that in last year, but then I think that's completely changed. It now feels really far away. It is a very, very multicultural society here. And I feel I've got a better work-life balance than I did when I was in medical school or internship or in the SHO jobs that I did in Nairobi. Free healthcare is a big bonus. You have to pay for your prescriptions, but they do have exemptions to that. For example, pregnant patients don't have to pay for their prescriptions. Any patient above the age of 60 or less than 16 doesn't have to pay for prescriptions. Students, in university don't have to pay, so they're quite good that way. And public schooling is free as well, so that's another bonus. Put political climate there, but I don't have much to comment. And then you are considered a highly skilled worker in the UK. You come here through a point-based immigration system. So when you're applying for your visa, the fact that you're a doctor counts for a lot more points than it would for any other job. And then, of course, for people that like football, and you've got the Wimbledon going on at the moment, other bonuses. So how easy is it to come home was another question. You get about 28 days of annual leave a year, but it does increase as you get more experienced. So I believe if you worked in the UK for 5 years, you then go on to 35 days of annual leave. If you book your flight in advance, they're much cheaper. But obviously, it depends on the situation. I haven't been able to visit Nairobi since last year. I think longer. Yeah, it's been ages. And yeah, my advice is stay positive. It's very possible. Someone asked me if I had any contacts when I came here, and I'll be absolutely honest, I didn't know anybody. I didn't have, any contacts. I didn't have any friends I was doing it with. And it was really scary at the time because you just don't know what you're getting into, and also no one's really done it before. Versus the USMLE, a lot of people have done the USMLE, and I think lots of people were giving advice about that, but no one was really talking about the PLAB exams when I did it. I just did a lot of research online and just went for it, and I'm so glad I did. So I'll forward some of these links. Sorry, it's just small font, but you can have a look at them later. They do have some of the courses that you can use for your exams. And so we've got a QR code here. It's just for me to get a little bit of feedback. So you just have to use your phone, scan it in, and just answer a few questions. It just gives me a guide as to anything else that I could have included in the presentation, and just your thoughts. I'm open to questions if that's okay.
Yeah, thank you so much, Dr. Ritika. I think we've really enjoyed the talk. I personally can speak myself and say we really enjoyed the talk. My personal favorite was when you've included the day in the life. I think it was really, yeah, it looks really, really interesting, and some cases look like, wow, I can see doing something similar in KNH. Yeah. I think also you had asked about attendance. I'm seeing right now it's at 160, but at some point I saw we had a high of 164. So there are very many people tuning in and interested.
No problem. Okay.
So I think if Kamo is in, he'll handle the questions. Okay. I think we'll start by addressing the questions in the chat. We'll be reading them out for you. And then for anyone listening and really feel like they have a burning question, they can raise their hand and someone will unmute them and then they can speak. So yeah, Kama, you can take over.
Okay, thank you, Arisi, and thank you, Dr. Ritika. So I've seen a number of questions in chat. I'll start with them and then anyone else, as Arisi said, can raise their hand. I will start with, okay, Kelvin asks, what is the PLAB, first of all? It's his first time here.
I'm so sorry.
I don't know, is that an oversight on our part? We assumed everybody already knew.
Okay, I'm so sorry about that. Probably shouldn't have assumed we all know what the PLAB is. That's perfectly fine. So it's the entrance exam that you would use, professional linguistic assessment board exam that you would use. If you've heard of the USMLE, it's the UK equivalent of the exams. And there's usually 2 exams. So you've got the first exam, which is an MCQ, and then you've got the second exam, which is an OSCE. So you've got consultations to go through in person, and then you're examined. Hope that answers the question.
Okay, I hope Kelvin and everybody else who was wondering has been answered. I'll try and group the questions according to theme so that
Sure.
it's a bit organized. So now that I hope everyone understands what a plan is. Mursal asks, for during your application process, do they need a transcript? And if yes, do your scores or your grades matter?
No, as long as you passed medical school, it's fine. You don't need your transcripts. You need your graduation certificate. That's it.
Okay, I'm sure that's a relief to everyone.
So don't worry about the grades. They don't matter, and they don't decide what sort of doctor you will become.
Okay, and so from Grace, what training course do you enroll to for PLAB 2?
Okay, so in the page with the in the slideshow with the links, I put in 2 courses. So I did AMSUN Academy. So Dr. Samson is an incredibly experienced PLAB teacher. So he has trained students for over 20 years, I believe. And the reason I did the course with him is because he had mock exams that were actually like the actual exam with the 18 stations, and he had actors, patient actors, professional actors at each station. And I went through that so many times, and he was extremely critical and extremely harsh with feedback. But I thought he was amazing, and I did really well in the PLAB 2, and I owe all of that to him. So I'd say the courses for PLAB 2 are a little bit expensive, but it's really difficult to know what you need to do without them. And I think they really, really prepare you, not just for the exam, but also for working in the UK and how to approach patients in general. So I did AMSUN Academy. I would recommend them any day.
Okay, thank you. Norman Derito asks, what is the salary scale for medical officer jobs after you're done with your PLAB 2? And what kind of life does it afford? With like level of housing, basically your quality of life on a salary.
Okay.
I hope.
Okay, so it depends on what your lifestyle is like and how how much you spend. It's individual as well. Your salary scale, it changes. It does go up a little bit every year, but you do start at a basic salary of about £38,000 a year. So every month it comes, if I roughly convert to Kenyan shillings, between 250,000 to 300,000 shillings per month. That's after taxes, so that's after tax deduction. In terms of your living expense, your level of housing, it depends on you as well. So when I had my first job here, because I didn't have very much, I stayed in hospital accommodation, and I used to pay about 20,000 shillings a month, including all bills, which is really good, I think, and that enabled me to save a little bit. Then when I moved to my next job, I had a nice little flat, and when I moved to my next job, and then you can sort of look into buying property. You slowly move up the ladder. But it depends on you. When you come here, just start small. I would say, take your time to settle in first. And then when you've found your bearings, then you can look into, every place is different. So London is really expensive, but if you live in some of the outskirts, you can get, your rent would probably be half of what it would be in London, and you get to save that much more. And a lot of people do shared accommodation. So there's lots of different options. And your salary does go up every year as you get into training. Also depends on whether you do night shifts and weekends. So if you do, you earn considerably more.
Ilhan Mohammed asks, what if you don't need a visa to move? I'm not quite sure what that means. Are you a citizen? But
so I assume if you're a citizen, You still need a GMC license. You still need a GMC license to work here. You will be saved the hassle of doing the visa application. So if you're a citizen here, you probably don't have to apply for a visa, but you still need your GMC license. You probably still need to do PLAB 1 and PLAB 2, just like everybody else, but you're saved the hassle of a visa. That part becomes considerably easier for you. When you apply for jobs, you'll be faster because you don't have to wait for a visa and things like that. You just come in and settle and move and start.
Regarding the job applications after you're registered, will you be applying for jobs while in Kenya and traveling to the UK to attend the interviews, or do you get a visa to? Okay, you're already shaking your head.
So I applied for all my jobs when I was in Kenya, when I was working in Kenya, and I had all my interviews on Skype, and it worked out fine. This was even before COVID, and now even after COVID, it's even more, Zoom, and you've got all these other platforms. So it works out perfectly. They don't need you to come there if you can't. I didn't need a visa at that time.
Okay, and then we have some related questions. Do PLAB marks affect entry into master's programs, or is that solely based on the entry exams, and can one reseat exams if one doesn't get in the first time? And then somebody asks after that if you can expound on the Royal Colleges and what they're all about.
Okay, so in terms of the PLAB exams, your score doesn't matter. Obviously, it feels good to score more, but your score doesn't matter. The PLAB exams get you your GMC license, and after that, nobody asks you about the PLABs ever again in your whole life. I think nobody here, everybody I work with, have no idea I ever did the PLAB exams. They don't know, that I had to go through all of that to get into this position. So your PLAB exams, passing those gets you your GMC license, but your training entry exams, your score matters. So the more you score, the better chances of you getting to work where you want. London is the most competitive usually, and then you've got everywhere else, the outskirts of London follow London. It's not impossible. Lots of people get in and around London. Now, in terms of the Royal Colleges, so it's slightly difficult to explain. So you've got the GMC, which is your governing body. It's like the KMPDU equivalent. So we've got the GMC, and each specialty has a Royal College that looks after the training. So it's a team. It's essentially a team of members, really, really experienced physicians and consultants. The book Kumar and Clark. I don't know if the internal medicine book that we used to use. Dr. Kumar is one of the panel members in the Royal College for GPs. So essentially, you've got a panel for each. And if you look at their websites, each specialty has a Royal College website. So you've got Royal College Pediatrics, you've got internal medicine, you've got oncology, you've got a hematology team. They come in useful. So essentially, they set out the guidelines for your practice. They look after your training as well. So if you apply to be a GP, you would apply through Royal College of GPs, and essentially they look after you throughout your training and afterwards. They run the GP courses, they give you your training. If you want to become a PLAB examiner also, you do it through them. So they've got all of these different options. You've got a Royal College of Dermatology. So they look after all your dermatology training. So these are specialists that look after that specific area. So it's called a Royal College. It's not really a physical college, but it's a really big team that do a lot of work. I can put in some links for that. You can browse if you like. Hopefully that would make it more clear. It is difficult to explain because they do so much. So each team, we've got a team for emergency medicine. Every specialty has its own team. Forensic pathology has a team. So each team is so different, but they look after your training, essentially.
Lucy wants to know if the path is similar for dentists.
Sorry, I didn't hear that.
Lucy wants to know if the path for dentists is similar or they have a different board.
I believe you've got different exams. I'm not 100% clear for dentistry. I'm sorry. I have some colleagues that have gone through that route, so I can find out. I'll share my link. So I think I spoke to Christopher and I said, I gave my Twitter handle. So if you want to ask me any questions on there, I'm happy to answer them as well. And I'll give you my email address as well. I do take a little bit of time just because of work replying to email addresses, but I will get to it eventually. Yeah, you can always, Twitter might be easier and I can write back to you. For the dentistry, I can find out for you and let you know. So if you just maybe drop me an email, and I'll give you all the details. I'll ask one of my colleagues.
Okay. Kelvin wants to confirm all med courses are free.
Yes, the only fee you pay is your Royal College membership fee. So for you to be in a training program, you have to be a member of the Royal College. And for you to be a member of the Royal College, you have to pay them a certain amount. It's not nearly as much as anything you would pay anywhere in the world for training. It's about £200 to £300 a year at most. The Royal Colleges do give you your certification. So when you finish your training, they will have a ceremony. They will call you and sort of give you your certificate, and yeah. So they look after your entire training. So you're paying them a small amount, but you're not paying a training fee at all.
Collins would like to know if you have an estimate, or if you know the total cost of the process from the start of application to getting accepted for the job and moving and all of that.
Okay, so I would say, so exams, you can, give them about £1,000 just for exam fee total. Your flights, you can add another £1,000, I would say. If you come here once for your PLAB 2, if you do courses, you can add another 500 to 600, with accommodation, maybe another 1,000. So I would say a higher estimate would be between 500 to 600,000 shillings, which is quite a lot of money. But I think it's worth the investment. You're investing into your future, essentially, aren't you? So.
And then part 2 of the question, at what job entry would you advise someone to apply? For example, if someone has just completed internship when they're applying.
Start. So if you've completed internship, book in your Ielts exam and just start. Just do the Ielts and you've done, that's the first hurdle done there and then. Ielts is not hard. We all speak English. We read and write English. So, what I did for Ielts, they sent me, when you book the exam, they send you links with some exercises to practice, some past paper exams. Just do them. They've got some listening exercises and comprehensions. You just have, it's like basic English. Just do the exams and, just book your exam, I would say. Yeah.
Boy, if you would like to know, if you decide to go to the UK as a fellow, is the process similar? Do you do the MRCP exams over the PLABs for Gmc registration?
So, if you come as a fellow, meaning you've completed postgraduate training, you're fully established and you've completed postgraduate training but completed all your Royal College exams. Come as a fellow, you have to do something called CCT, which is a completely different route. So it's a route to become a consultant. So you have to work here for a couple of years, I think 1 to 2 years. They have competencies for you to fill out, to complete, and then you can, work as a consultant or fellow if you wish. But yeah, I can share some links. I'll just take note of it. So for CCT, it's a whole different pathway as well. But you need to have finished your Royal College exams. And I think that comes a little bit later when you're established as a consultant in your home country and you've got so much experience and you've completed your exams, and then you want to move. Then you would go through CCT. You would still have to work as a senior registrar for a year or 2.
Any advice with regards to more documents you can get in addition to FY2 competencies while in Kenya for the job application?
So the ECFMG that I mentioned, those are the ones that take time. You know, the logbook, your logbook from internship, make a photocopy of it and have a copy for yourself. That will come in handy. Any certification you do, so, you know, advanced cardiac life support, BLS training, you know, ATLS, they all come in handy when you're doing your job applications. So the more you do, the better. And then, you know, the really basics, MBCHP certificate, they need your bank statements and things like that. So you have to be quite steady, you know, don't move too much money around, and, you know, just have a steady saving income, you know, just through the month. As soon as you start your internship, I would say, you know, try and look after that if you can, but it doesn't have a big impact if you don't. Yeah, I think those were some of the ones. I think visa application is where you need more documents, because you have to show evidence of your training here, of your training back home, but you've got all those documents anyway. They do sometimes need you to show evidence that you're coming here for a job, but the team here, so wherever you get your first job, they provide you with certification sponsorship as well. So it's called a cause form that they provide you for your visa application. So you can't apply for your visa until you get a cause form, but if you've accepted a job, it's their, you know, it's the HR team, it's their duty to give you the cause form in good time before your application. If you've got that cause form, you really shouldn't have any problems with the visa application. So these are some of the ones I can just think about through the top of my head. Yeah.
Okay. Felicitas wants to confirm, are they going to replace PLAB for another exam as the entry exam in 2 years, something called the MRA? Felicitas heard.
So there have been rumors about, not MRE, but something about called the UK MLE. So like the US. There have been rumors, but they've put that all on, you know, backseat because of COVID now. They've been struggling just getting people to come here for the PLAB 2 exams. They have made the PLAB 2 exams a lot more frequent than in my time. So when I was doing them, they used to do them twice a year. And now because of demand, they're nearly, I think every couple of months you can get a PLAB 2 exam. So I had to wait till November, otherwise I'd have done it, you know, the next possible slot. So at the moment, I think they're not making any changes at least until 2022 September, and then they're due to review again. But any change that they make takes a lot of organization. They have to test it amongst themselves. They wouldn't just, you know, just bring up the UKMLE and throw it on everyone. It would be a very stepwise process. They have to implement certain guidelines for it as well. So if they were to make any change, I think you would have good enough time to sort of organize yourself and just be more aware of changes generally.
Okay. So what would you recommend that we do as undergraduates right now to make our application process easier and make us more eligible?
If you can, you know, if you can sort of start looking into work as a research assistant, it doesn't have to be anything paid, you know, just help out with audits here and there. I would say the main focus should be getting to medical school and the requirements, and if you've done that, you shouldn't have any problem. Your certification, so for me, because I'd done basic life support, ACLS, ATLS, and the pediatric life support, advanced pediatric life support, that was really quite handy. They really liked that I'd done neonatal life support and pediatric life support, because I was applying for a neonatal ICU job as my first job here. And that gave me an upper hand, I think. I got the job instantly because I'd done those. So you don't have to do them when you're in medical school. You can do them, you know, during internship. They have to be valid when you apply as well. But I think most of them are valid for about 4 years, 3 to 4 years. So if you can do them towards the end of medical school, they would be helpful with your skills during internship anyway. So I think you should think about doing them anyway, but they would come in handy for your jobs as well. So if you can manage research and things like that, that's good. You can do small audits. it's just small sort of study research projects. You can do it as a team. You don't always have to do them by yourself. You know, for example, just looking at sleep habits amongst medical students or stress levels amongst medicals. It doesn't have to be anything major, but just put some of those little things on your CV. They're always helpful. And yeah, I think the training, the more courses you do, the better.
Okay, Diana, who would like to know, are there any the hardships that you faced, work related or others during the application process?
The application process, I think, so I'll start with the application process. It wasn't as easy as it seems, but it's very doable. When you're applying, you're always asked for different documents. You have to sort of figure out how to get them all, but it's very doable. In terms of, I think that was the tougher bit for me. Also just waiting. You don't really know if you'll get a job. You don't really know if your visa will go through, but it always generally works out if you do everything that they ask for. In terms of work, when I came here, it was completely new. They gave me about 2 weeks induction time where I got to shadow some of the doctors. Everything was done differently, and I mean everything, including prescribing, taking bloods, sending off bloods to the lab. You know, we use pod system where you put in the blood into a chute, and then you have to type in a number on a little computer, and then it goes off to the lab automatically. Having everything online, so all your documentation is on a computer system, medical records in a computer system, documenting everything. So if you communicate with family, you document. You know, if you make any changes or you review a blood test, you have to document. So that's really important. So learning all of that, I found it was a steep learning curve, and I think every time you change your job, you will have a little bit of it, but they do ease you in. They don't just, you know, throw you in the deep end. They're always aware that you're a new doctor in the country, and they help you acclimatize. So when I joined, they even had a couple of socials where they got the nurses together. They used to make sure we had lunch together, and they would have a couple of, you know, dinners and things like that. They would organize so that you get to know the team better. They always say, the team I worked with always said, you know, we used to eat lunch every day together with the consultants, and they used to say that the last thing they want is for us to be afraid of them. They want, you know, they want to be so easily accessible so that you can ask them a question anytime. You know, it's worse and more risky for you to be scared of them and not be able to ask them when something's going wrong or you're not sure about something. So they've got slightly different mindset, you know, in terms of that. They've always been so approachable. I mean, the team I work with now, they're incredible. Never felt, you know, out of place. Always have a lot to adjust to in every job. But I think they're always understanding of the fact that you're new to the system. You just have to make it known, and just to give you the time you need. If you're struggling, you just have to communicate. And you know, for example, when I started my first job, the neonatal resuscitation, we never had the bag, valve, and mask. You know, the BVM that we used in Nairobi. Here we've got something called a neopuff, which you can do. You know, you can change pressures and things like that when you're resuscitating. And I was asked to use a neopuff, and I had absolutely no clue. And they organized a training day for me, just so that I can learn all the equipment. They were really nice about it. They gave me assessments, and once I was confident, they let me do it on my own. So you just have to make it known. If you're not sure of something, always ask. I think that can be one of the challenging bits, but it depends how you look at it as well. Just take it as it comes. You're here to learn. So if someone tells you, you know, they never really tell you off because they're not allowed to. But if they, you know, do give you feedback, just take it positively, work on it, and it's just your mindset as well. So you come here thinking and aware that you're here to learn. So you definitely will have an adjusting period, but you'll settle. If that answers your question.
Okay, Grace asks how much are the courses by AMSUN Academy, and what are the other options for work and living apart from London?
Okay. So the Samson courses, the PLAB 2 course, in my time was about £700, and I believe it's around the same now. So it is expensive. But if you're going to do the exam once, you want to do it well, then just do it. I think it's worth it. It's a struggle doing the PLAB 2 on your own because you don't really know what to expect. They've got specific things that they like. He's got all of these. So there's another academy called Swami Academy that was quite popular as well. It's still quite popular. They've both got mannequins for practice. One of my stations, they asked me to put in a urinary catheter. One of my stations, they asked me to do a speculum examination, and they had dummies there. And I had one dummy that was having difficulty in breathing but could talk. So he's telling you, he's giving you a history. So it's a recorded, someone speaking into it. And so instead of having all these things come up as brand new, because I'd practiced with them already in his classes, I just, you find it a lot easier on the day. And you really can't do that on your own, I think. Someone had asked, earlier about doing the exams again. So you do have, I think the PLAB 1, you can do it maximum of 4 times, if I'm not wrong. And the same for PLAB 2. So you do have another chance, but I think they're very doable. You can do them on your first. You can do them on your first go, especially if I think coming from UN, you can do them, no doubt. Yeah.
And Cynthia wants to know, what is the duration of time that you must wait between the PLAB exams?
To read, sorry.
Is there a time that you need the duration that you need to wait between PLAB exams?
You need to do your PLAB 2 exam, you need to have passed your PLAB 1. So you can't book your PLAB 2 until you pass your PLAB 1. And the PLAB 1 results take about 3 to 4 weeks to get. The day you get your PLAB 1 exam, just book your PLAB 2 exam. That's the way it works. That's what I did. So you don't have to wait any longer than that. And then your course, if you want to do the course, book your PLAB 2 exam first. They always tailor courses around the exam, so there always be a course in between anyway. You can.
To a lighter question, or not, social one, someone asks, how easy or hard was it to make friends? And romantically, how easy is it to have a life partner?
Okay. Well, good questions. In terms of friends, I'll be honest. So I'm a bit of an introvert when it comes to sort of socializing, making friends, but you tend to make friends with the people you work with more, I think, just because you're from the same sort of background, you're going through the same things, you're at the same level. So most of my friends are people that I've met through work, and I don't think that's a bad thing. So quite easy. They always have social events, at work to help you make friends. They don't want you to just be work colleagues, just come to work and go. There's a big focus now on a holistic approach in terms of doctors and their mental health and things like that as well. The job I'm doing now, I was talking about portfolio, and it's mandatory for me to write entries about how I implement a holistic approach. So what I do in my free time, my hobbies, how I interact with friends and family. There's a big focus. When I have my tutorials with my trainer, the first question, they normally ask me is, what did you do on your weekend? How are you coping? There's such a big focus on doctors' mental health now and managing stress. And there's so many services available as well for patients, for doctors now in terms of stress management, including even when you're training, you have free access to all of these services. In terms of life partner, difficult for me to comment on that one. I think there's an element of luck there, I guess. it's also how social you are and how much you interact with people, I guess, how much you put yourself out there and what you're looking for, I think. I did get, I personally got lucky when I got married. Didn't get married immediately, but about 2 years into my stay here. So, if you put it out there, it will happen. I can't give you any guarantees about that aspect of things. Yeah, you have to just take it as it comes, I guess. Make friends, just be proactive. If you don't have anything going on a weekend, just send your friends a message. Let's do this. The good thing about being here is there are always so many activities going on. There's so much to see and there's so much to do. You can't say you're bored. I don't think I could ever say that. I don't think I would ever say that in Nairobi either. But there's always, because it's a new place, there's always so much to explore. And you don't necessarily have to pay money to do a lot of things. There's a lot of free events and free things going on. So yeah, I hope that answers your question a little bit.
Okay, in keeping with the theme of spouses, Dan wants to know if you can move with your spouse once you're registered to work there.
Yes. So once you've got your job, you've secured your GMC license, you've got your job. When you apply for your visa, you have to apply for a visa. You have to also apply for a visa for your partner or your kids. They would come in as your dependents. So very possible. And they don't. So your partner, for example, doesn't have to have a job here to come here as your dependent. They can always come here and then look for a job afterwards. So that's a good positive, I think. You do have to show enough funds to look after them. So I think it's about, it used to be about £1,000 per family member you're bringing in as a dependent. And it has to be either your partner or your children. It can't be your nieces or nephews or aunties, nothing like that. It has to be an immediate member. So yes, very doable.
Okay, Gideon wants to know how racism is in the UK.
Okay, I think every country has its pros and cons. The UK is incredibly multicultural. I have to say that. You wouldn't walk on a street without seeing people that are similar to you. There is a big, you might have heard about BAME, the BAME sort of things that are going on, the ethnic minorities and things like that. There's a big focus towards that at the moment. In my own opinion, it's not as bad as the US or the things that you hear about in the US. Things here are so multicultural. You don't actually feel it because you work, you work in such a varied community, even at work. The HR teams, and when they interview and when they select people for jobs, they are forced to have a balance between the different ethnicities, different cultures that they employ as well. You're never by yourself. You've always got like-minded people. You will find we've got Kenyan shops here in London. I can get ugali flour, I can get sukuma wiki, and I do, I'm not missing any of those things. Everything is available. It's so handy. So I don't want you to be afraid. I think that would be my answer.
Okay. Where was I? Do private practice. So Nicholas wants to know how or if he can get into private practice.
Yes. So private practice has its pros and cons. You still need your GMC license just the way you would do your PLAB exams. Some of my colleagues that I did the PLAB exams with, I think one of my colleagues went into private practice as an SHO. You earn a little bit better, but they do sort of own you in a way because they give you your hours. They can make you work as much. You're not that flexible, but you, as a consultant, it's great. So a lot of consultants will work part-time in private, so they'll do a day a week in private practice and then the rest of the time in the NHS. Obviously, If you choose to go fully private, it's totally up to you. Still similar guidelines to the NHS. You might be paid a little bit better, but not much of a difference. You can always negotiate your terms in terms of your hours and things like that. You will always have a work-life balance, whether you go private or NHS, doesn't matter. So yeah, I think if it's something you're interested in, it's a good option.
Okay, Esther asks a number of questions, but I'll start with the most important. Is it a guarantee that if you pass your plabs, you will get a job?
I think it has become slightly more difficult than it was when I was applying because there's more numbers. But there is such a huge demand for doctors here. I think Kenya is already massively short of doctors. And I don't know what the ratios are like now in terms of number of patients to a doctor. But here they actively strive to reduce that. There's always going to be a job for you somewhere. You might not, your initial job might not be where the place that you want it to be. But I think that's absolutely fine. The NHS is pretty standardized in terms of the hospitals. They all have ratings to maintain. So wherever you go, you wouldn't find much difference in terms of the workload and things like that. Yeah, so just take it as it comes. And yeah, but it should be. Sorry. Yeah. In terms of job applications, you just have to persevere. The more jobs you apply to, the higher your chances of getting invited for interviews and the higher chances of you actually getting the job. Yeah.
Okay, she also wants to go back to why London is so competitive. It seems Esther wants to go to London.
It's the city. It's the central hub. It's got everything going on, at the same time. It's got, it's competitive. It's a great place to live in. It is expensive. But it's got a mix. So if you're, I live right on the outskirts of London. So for me to get into London, if I walk 5 minutes this way, I go into London. And if I walk 5 minutes this way, I go into the county of Essex. My work is about a 12-minute drive from home, which is in Essex. So, I'm sort of in London, but not really, which is great. So you've got that sort of option as well. London is just, you've got so much going on, from theatre to, you've got the main city centre, the shopping hub, if that's what you're interested in. There's just so much to do. And I think in terms of a social life, London is probably where you would meet most people, if that's what you're interested in as well.
Okay, I think you answered the question about racism, which this is a repeated question. So back to Effie, what are some of the ways you can make yourself more competitive when you're applying for your residency programs?
So any courses that you've done, so courses in terms of your certification, your life support certification, just basic things like that first. If you've done research and audits, that will always give you an upper hand. If you've passed the Royal College exams even before you apply, so for example, you do your PLABs, you come here and you're doing your SHO job, and then you decide to do the first exam for any of the specialties. For example, you want to do surgery and you do the first MRCS paper and you pass it, you already have an upper hand when you're applying for training, because they know you're totally committed to that field because you've passed the first exam. And then in terms of your e-portfolio, for example, if you are inclined to do surgery, then the more procedures you log into your portfolio, the more things that you assist with or you do, the patients you see, the courses you do in terms of surgical skills, they will take all of that into consideration as well. So it would give you an upper hand. There's a lot you can do to help with your training application.
Okay, Hussein wants, I don't know if you'll be able to tackle this, but he wants to know if you can compare how it is to study in Canada or the UK, which is better, which is more affordable.
Difficult for me because I have no experience with Canada. I have to be honest. I think Canada has a slower paced lifestyle, but I don't know what the exams are like, and I don't know how easy or tough it is to get into the residency programs. I'm not too sure, I'm sorry.
Okay, Hussein, I think I can take that. Hussein, we covered Canada last Sunday. If you can get in touch with one of us, I think we can send you the links to the recording, and that should help you out. Then finally, assuming you get the, Hamza wants to know if there's a path to citizenship while working as a doctor and how he'd or she would go about that.
Yeah, so that's the goal as well. If you want to live here long term, you have to work in the UK for 5 years on the same visa, so the Tier 2 work visa, and then you become eligible to apply for an indefinite leave to remain. And with your indefinite leave to remain, that puts you on path towards British citizenship. So it's not difficult. You just need to have consistently worked here for 5 years, and then you can apply.
Okay, thank you so much, Doctor. I'm going to hand over to Arisi now. He'll tackle the rest of the questions because it seems there's a lot of interest.
Thank you.
Okay, so thank you, Kamau. So Dr. Ritika, I'd like to start with a question, actually, my question. So you mentioned the Plab 1, it cannot be done in Kenya. You mentioned, I think, Nigeria. So can I know the other options that we have, like which other areas where can you do that exam? And should you like plan how to move on the exam day? Just a little bit on that Plab 1.
Okay, so I know Nigeria does them. I know Egypt does them. South Africa does them. India, Dubai, all do them. I think for your Plab 1, you don't want to, you don't want to spend too much at that point. You can also come to the UK. Another idea is for you to do both Plab 1 and Plab 2 with one visa. So, which is what I managed to do. So if you do your Plab 1 exam, for example, you have to be really sure that you pass your Plab 1 exam and you book your Plab 2 exam. You get your visitor visa for 6 months. Can you finish both in 6 months? Then you can, book your Plab 1, for example, June, and then do your Plab 2 in September and have them both done and over with in one visa. So that would be a really clever way of doing it. But it's not always possible, especially if you're working. So, in terms of the Plab 1 exam you just need 1 day for it. But I think you also need time to settle into the place. You need to know your exam center, where it is and be comfortable going there, the timings and things like that. Also to adjust to any sort of time differences. So I'd say give yourself a couple of days before going to your exam center. Accommodation has become increasingly easy to book. So when I spoke about AMSUN Academy for the Plab 2, one of the reasons I really liked it as well was because they sorted out my accommodation, and they don't normally do that, these courses. And they were really reasonable. I stayed with them. I stayed in a house with other people doing the Plab 2 exam, and we were able to study together after the course. So I think that was amazing, and you also become friends that way, and we're still in touch, to date. Most of my colleagues were from Nigeria, actually, so that's why I know about the Plab 1 centers. I think they've got a couple of centers there, and I think it's whatever's easily accessible to Kenya, whatever's affordable and you think is doable in terms of you going there. I can send you a list of the country the centers. So I'll just put a note. Yeah.
So I think you will just get the lists. You can send to me later, then I'll share with everyone. So I'm seeing another question here. I think it's a repetition, but maybe we'll just talk on it. So Grace is asking, please repeat the other academy that you can access apart from AMSUN Academy.
The other one I know of, I think there might be more now, I don't know, but these are the two that I can vouch for. The other one is Swami, so SWAMY. I have some friends that did their courses there, and he's also really good, really experienced. He's got a team that teach. AMSUN is in London and Swami is in Manchester. But for your PLAB 2 exam, you normally have to travel to Manchester from London. So what I did was I stayed in a hotel the night before and then did my exam and came back the same day. So yeah, you just have to plan. Sorry.
The other question. From Ilhan Mahmoud, he's asking, what difficulties do you have while preparing for the entrance exams and planning the move?
So in terms of entrance exams, do you mean the PLAB exams or the residency entrance exams?
I'm not sure, but I think since you have said before the move, I think it means the PLAB exams.
Okay, difficulties, motivation to study, I think is the first one. Getting through all the question banks. AMSUN Academy do great mocks on his website. They've got mock exams, so those are really good. I think studying is the tough. Getting yourself to study is the tough bit. That was for me, but it's doable. It's easy if you find a study partner. And when I did the 1700 questions, I was working full time, but every day after work, and my study partner wasn't even in the country. We used to do it on WhatsApp video, and she was in Nigeria, and we used to do 100 questions a day. Every day after work, no matter how long it took. And then once that was done, I'd done my questions for the day and I was fine. And that way you remember more, you're discussing with someone. We used to make notes, and then the second time you do the question, it's just so much faster. First time is tough because there's a lot of new content. You have to familiarize yourself with some of the UK guidelines as well, which are completely different. So I think that's one of the tough bits. And then getting yourself started. I think the hardest step is just taking the first step. The minute you book your Ielts, you've devoted yourself to the path and you're on it. And that's usually the tough. Just be brave and do it if that's what you want. Don't be scared. It's a bit of an adventure. You don't know where you'll end up, and you get to explore a lot. You get to see a lot. And if your aim eventually is to go back to Kenya and improve the services there, or help with training and education, and just go back and work in Kenya, you would be in a much better position, a lot more experienced. You might be able to do a bit more than you would have otherwise. So it's always something to learn.
Okay, so the other question is, in your opinion, this is from Effie, in your opinion, is it easier to move to the UK before you do your postgrad degree or after?
Postgrad degree, do you mean the MSc or, sorry, do you mean the MSc or the residency? Sorry, I can't hear you, Chris. I think you're on mute, sorry.
Chris is muted.
Sorry, so I think she means like you do a postgrad in Kenya, something like internal medicine or surgery, then after that you move. So is it better to do after, try make the move after postgrad or before that?
That's an individual sort of decision. I think you don't waste too much time if you move before. I think when you do it after, you still have to do a lot of acclimatization to the system here. You still have to start not as from scratch as you would have, coming immediately from med school, but you still have a lot to learn. You wouldn't come in as a consultant straight away because you need to be at the same sort of training level. There is no consultant here who is not a specialist in a certain field. So even if you're a pediatrician, it's very difficult to be just a pediatrician. You have to be a pediatrician with interest. So you've got a pediatric nephrologist, you've got a pediatric community specialist, you've got a safeguarding lead. That is the difference. So when you do pediatrics in Kenya, for example, you do your 3 years and you're a pediatrician. But when you come here, it's an 8-year program, but by the time you're in your by the time you're in your 4th or 5th, by the time you're in your 4th year, you have to select your subspecialty, and you're already working at such a high role. There's not much difference between you and a consultant. Really, you work together, and you're already a specialist. So you run that specialist clinic. You see you work in hospital jobs in that specialty. So you come out either a neonatologist or pediatric rheumatologist. You never come out a pediatrician, you know. The same for GP, you know, the training program that I'm doing. I will become a GP at the end of 3 years, but you have to sort of branch out and choose your special interest. So even though you saw a day in my life, you saw all those cases I saw, but then you can pick, you know, you can be one of the doctors I work with in my practice. She is an antenatal and postnatal lead for the practice. So she will do all the postnatal checks for babies. She, you know, you choose what you love and you branch out into that. And I think that's the advantage. So if you have completed postgraduate training in Kenya and you come here, you probably don't, and you've done some of the exams, so the Royal College exams, you probably don't have to start at ST1, ST2. You might have to start at 3 or 4. So go back a little bit, and then, you know, go into specialty from there. So to be honest, in terms of timing, I don't think there's much of a difference because you'll have done 3 years in Kenya. You might as well do those here. So it's up to you.
Alafu there is another question. If you did IGCSE in high school, do you have to still do the Ielts exam?
Yes, unfortunately. Even though we can prove our English proficiency as much as we like, but they want the IELTS. So I asked that question because I had done IGCSE English, and it's not acceptable. You need your IELTS. That's the standardized way of them knowing. Even if you had an A star, it doesn't matter. Yeah.
Just to jump on that question, sorry, Chris, because I also did IGCSE. I looked it up and they said that I guess it depends on your examining board, for example, or it's all board.
They say, I know there's Edexcel and there's Cambridge and all of these, and they always, they say your examining board. It's different for people that are in Europe. But when I asked, because I had done Edexcel English, and I also got a letter from UN stating that my entire learning was in English, I still had to do the IELTS. So they said, you know, so the other thing is if you plan to do an MSc or a postgraduate, you know, research degree or anything like that, you still need your IELTS. When I did my IELTS, it was because I wanted to do an MSc and not for the plabs, but I luckily got the score for the plabs and I was able to book them.
Okay. Next, Samson is asking, can TOEFL, I don't know what that is, TOEFL be accepted as an alternative for IELTS during application? I don't even know what that is, honestly.
I think that's the English exam for the US. You do it for the US, if I'm not wrong. I think you can, but that was when I checked, when I did the exam. So I will check for you and I will let you know as well. That's okay. I'll pass the message on to Super.
Okay, so Harshita is asking regarding internship, is there any specification on if it has to be at the public sector only or internship at private sector does the same good? So I think she's asking, like, if you're in Kenya, whether you do it in a public or private sector, does it matter?
I think it does. When you open your GMC account, which you can all do now if you wish, you can open your basic account and start entering your details. You have to put in your internship center, and most of the private ones, you know, I think Aga Khan Hospital, MP Shah now, they're not really validated for the UK. So it has to be a recognized, the reason they like the government, you know, pathways, because they know you've done the necessary rotations that you need to do. They know it's standardized. So they know, you know, the Ministry of Health in Kenya. So they have that sort of background information already. So, you know, last I checked, I think I was checking last year actually, because someone was asking me to check, you know, they wanted to apply for private. And we tried, and I think we tried emailing the GMC as well to ask. and there was no definitive answer back. They said, we're not sure. But for you to go through all that effort, and then they say, actually, your internship center doesn't count and you need to start from scratch, which is difficult if you're not a British citizen, it just isn't worth it. I think, yeah, just go. Best thing is to go the government route and do what you need to do. It will be tough. I think you don't know where you end up in Kenya. I think that's a bit of a challenge as well. But I think that's what's recognized at the moment. You can always email them to ask. The GMC, they always reply. I think within a week they reply normally. Yeah, I didn't get any definitive answer to that question from them, and I think they were doubtful as well. So I wouldn't trust the pathway here.
So another question, it's from Pratik. The question is, what type of visa do you apply for the PLAB2 exam? And then, so I think let's just add it, because I see another question on what is the process of getting the visa, how difficult is it? So maybe you can all put them together in how do you apply for the visa from the beginning? Is it hard? So yeah, I guess you can just all put it in the chunk of talking about visa.
Okay, so for the PLAB exams, you need the visitor visa, which is fairly basic to get. You have to apply in good time. I think the visa application center is done through these private centers in Kenya, and it's an online application. You fill out the forms and then you have to go there for a biometrics where they take your photograph and get you to sign things, and fairly basic, you know. I think there's a fee as well, which is a little bit expensive. I found it really expensive. I think I paid like 30 to 40,000 at a time. But it lasts you for the 6 months. It's worth it if you can manage to do your PLAB 1 and PLAB 2 in one visa. It doesn't feel that bad. So, you know, it's tricky. In terms of the application process, not difficult. I think they look at the funds. So you have to have funds in your bank account. They want to make sure when you come here, you're not using, you know, public resources. You're not using, you don't have any allocation of funds when you come here because you're coming in as a visitor. They want to make sure, I think for you to live in London, you have to show at least £1,000 per month that you're here. Another thing that's quite handy is to, if you get a travel agent to provisionally book you, you don't have to pay anything, provisionally give you a booking for a flight around your dates of the exam. So they give you a printout with a provisional date for your booking. You don't have to pay for it yet. Just around your exam time, print out confirmation of your exam date, and you have to show proof of accommodation, which I found was really good through AMSUN Academy, because they gave me a letter stating that I was going to stay with them and the address, and they sort out all that for you. So really, it's not too difficult. When you look onto the visa, on the visa, so the visitor visa website, you will get the list of documents that you need. You don't need to give too much, stick to the list. Don't need to go overboard. But then you need proof of accommodation, you need proof of finances, and you need to show that you're definitely coming for the exam. So you've booked your exam and print out the confirmation. And I would also write a cover letter just stating that you're a doctor, and you want to move, you want to do this exam, and that's why you want to travel. And I also attached my MBCHB certificate just as a bonus. So you can, if you want, yeah. Then when you apply for your job, that's a tier 2 work visa. And it's not much different in terms of the documents, except the employment, you know, your employer has to give you the certificate of sponsorship form, which states your hours and your pay and things like that. You can't get a tier 2 visa without that. And the tier 2 visa is usually the length of your job. So if you're on a 1-year contract, you get the visa for a year plus a week. And then you just have to make sure you either renew your contract for the end of the year or you switch jobs. Totally up to you. And extending it is not difficult at all. They do it. Yeah, shouldn't be a problem. I hope I've answered everything. If there's any more questions, just let me know.
Yeah, I think you've covered everything. So also we're about to wrap up. So this is a question from Esther. She's asking now, just give us a summary, like a summary of, say, I've finished internship, or I'm about to finish internship. I want to go to the UK. So like what would be like in point form, like just a breakdown summary of like what you've said?
I'll try, because I hope I've not overwhelmed you with lots of different bits of
Yeah,
it.
like just keep it simple. Like if you just like this, then this, then this, just a simple one. Yeah.
Okay, fine. So you finished internship. First step is book your Ielts, the English exam. Pass your Ielts, then book your PLAB 1. Wherever you book it, I'll send you a list of the centers. Pass your PLAB 1 exam, and then book your PLAB 2 exam. Pass your PLAB 2, and then apply for your GMC license. Once you have your GMC license, apply for jobs. That's it. Hopefully that's it.
Yeah, I think that covers it, and it sounds so simple when you say it. Yeah. So I think it's almost 10 p.m. our time. So I think we can wrap up from here, and if you have any more questions, I think we'll communicate, and then I'm sure we'll share all the material she has shared with us. We'll get them, and the AMSUN team will share with all your class reps. So anyone asking questions, don't worry, all this will be shared with all the participants. So I think we'll wrap up here. So we'll get someone to give a vote of thanks. But before that, let me share something.
Oh, Arisi, I think I'm already sharing it.
Oh, you're already sharing it. Okay, so I'll just continue.
Okay, so I think we'll thank you everybody for attending. Sorry. Thank you, everyone. I think I'll ask the last question, a really short question, and then I'll invite the AMSUN chair to close this meeting and give a vote of thanks. Okay, so Dr. Ritika, I wanted to know, you mentioned you did an MSc.
Yeah.
You went into it a little bit, so I just wanted to know how easy was it how accommodating rather was the university in terms of you working part-time and still learning, and how easy was it to work as a doctor and still do your MSc?
Have to put a couple of, it's not as demanding as work that you're doing. They are really good in the sense that it's already a part-time degree. So when you're applying for a part-time degree, and they expect you to put a couple of hours a week at least. And in those hours, they give you assignments. So they give you questions that you need to answer. They give you a quiz every Sunday. So I had to wake up early every Sunday to do a little exam, and then have the answers reviewed. And you're supposed to pass those quizzes. You can't, so there's reading material for the week as well. It's very doable. If you gave it, I'll be very honest, I was supposed to give it at least an hour a day, but I would never manage that. And I would leave a lot of it to the weekends. And I would do, I'd wake up early I'd do a couple of hours on a Saturday, wake up early on a Sunday, and then work on it for a couple of hours, 3 to 4 hours, and I'd manage. They give you group work as well. So they put you in teams, and you have to write a paper together, do some research together, and then you have to submit it every 6 weeks. So there's a little bit of extra work. And then you've got final exams as well. So you've got MCQ exams, you've got essay exams. That's all in the first year. And you've got modules. So they split the topics you're learning into modules. For example, in my respiratory medicine, lung cancer was 6 weeks. So you do 6 weeks of learning about lung cancer, which is quite a lot of detail. They go into genetics and things like that. Very interesting. And the people teaching you are usually respiratory consultants in the UK as well. So they, you get in touch with all of these people. They can help you with papers and publication and things like that. So you have to complete 6 modules each year. And in your second year, you get to do a dissertation. So you choose a topic of your interest. You have to make a proposal, you have to submit it, you have to present it. And then you have to write up dissertation. I think mine was about 15,000 words. Took me a lot of time, that did, because you have to do drafts, you have to make a couple of drafts. You don't have to, I think they were really accommodating, because when I said I need a break, I'm moving country and all of that, they said that's fine, you can resume your next I took a break between the 2 years. And in my second year before my dissertation, I took a break as well. So, I think most places are quite accommodating. They'll say, that's fine, you can join in with the next batch. Just do it at your pace. It's part-time, and I think they understand that you're working as well. Yeah, so fairly good. I think it's a good experience. Not mandatory, but good for you to have.
Okay, thank you so much. I think I'll just put this up so that everybody else can see who participated in making this a success, and then I'll invite Winnie to finish this meeting. So this is the series so far. We've done 3. See my screen, we've done 3. We have the US tomorrow for those who are interested, and then we'll finish off with South Africa in a week. And these are the members. These are the members of the team that made this possible. So I'd like to thank all of them. And thank you again to our speaker. We're very, very glad that you managed to make it. And this session was extremely informative. And I know you'll have a lot of questions and a lot of follow-up. So yeah, we'll wait for you to answer your email whenever. At this time, I'd like to. If Winnie is around, I think she can say a few words.
Yes, I'm here. Thank you, Kamau.
Hi.
And just hi.
Do you mind sharing the email for Dr. Danda? Do you mind sharing your email?
Maybe Doc, perhaps I don't know whether you can.
I can put it in the chat box. Is that okay?
Yes, thank you. And thank you so much for this amazing session. Just to echo what Kamau has said, it's been extremely informative. And I think many can attest to the fact that of all sessions we've had, I think this has literally brought back a lot of hope. And there was so much clarity. It was very positive, and it appears to be something very doable. So thank you for your time. And I know this came a bit late into the night, but just thank you for being with us. Thank you, Kamau and Arisi. You guys have done such a wonderful job in facilitation. You brought out our questions very clearly. And also thank you to this planning committee that has been projected. You guys are doing such an amazing job. And also to the entire AMSUN exec committee. Thank you for your dedication and for the time you have put to make this possible. And on behalf of AMSUN, we really hope that this has made you better and you are at a place to make more informed decisions. Yeah, so stay tuned as we go to US tomorrow. Have a good night. Bye.
Thank you. Thank you so much, everyone. It was lovely talking to you. Bye.
Okay. Bye.
Thanks.